I personally experienced sciatica, severe sciatica, for 2 years after I herniated a disc in my back. So I'm going to bring out my model here to describe what that was. So this is a model. This is the spine. This is only the spine, and this is the pelvis. So we're looking at the front, and this is the back. The blue portion right here is the sacrum. This little green piece right here, if you can see that, this is called the tailbone or the coccyx, and then the lumbar spine starts here where it turns red. The sciatic nerve is made up of a bunch of single nerves that come out of the lower spine and the sacrum area, and they come out of this little notch right here. And I don't know if that's super clear, but I'll turn it so that comes out of this notch and it runs down the back of the leg. So what I did about, let's see, I think it was like 4 or 5 years ago, maybe 6 years ago, is I herniated the disc. And this model here really shows that. This is a bulging disc. You can see on the side there's a little, this is the spinal disc right here. This is what separates each section of the spine, or the bones. And this little piece just bulged out and it pushed on this nerve right here. And when that pushes on a nerve, that causes inflammation and pain and swelling and, you know, symptoms to shoot down the leg sometimes. And in my case, that's what it was. It was the symptoms that really traveled down my leg, and it prevented me from doing a lot of things in my life. And those of you who have had sciatica or know of someone who's had sciatica, you know it's debilitating in a lot of cases. So I got into injection therapies, primarily prolotherapy and prolozone, to address my problem. I was offered, you know, I went the conventional route in the beginning, and I was offered antidepressants, and there are reasons behind that for that prescription. If some of you don't know, antidepressants are commonly prescribed to help break the pain cycle. So I was offered antidepressants as well as pain medication and surgery. But the more I looked into the research, I found that there was really a difference between those who received a surgical procedure or underwent a surgical procedure to repair herniation, and those who did not, and those who did more of an active recovery, doing more physical therapy and reducing inflammation, and, you know, sort of changing the biodynamics of their movement in their body, actually did a lot better. Interestingly, a lot of us walk around with herniated discs, but not all of us have symptoms. So I figured, well, heck, if somebody else can have a herniated disc and not have symptoms, why not me too? So I started looking around, and what I found was a therapy called prolotherapy using dextrose and procaine. And after about 8 treatments, I was able to walk and stand and lift my children and play and drive all without pain again. So it took me about 2 years to find it. And so I'm really excited that I can offer it here for people who are looking for a solution, a non-surgical solution or a non-pharmaceutical solution to their back pain.